What are the symptoms of fatty liver, best treatments, and what should you do? Which tests indicate fatty liver, and which ones show liver problems? Your liver might be inflamed. I'll cover all of this in this video. Let's start with the signs and symptoms of a diseased liver. First, note that early stage or mild fatty liver may not show any symptoms. Symptoms begin when the liver starts to become inflamed. This can lead to changes in blood test results. Inflammation can cause scarring, fibrosis, and cirrhosis where liver function declines. Liver cells die and are replaced by non-functioning cells. As the liver loses function, symptoms start to increase. That's why it's crucial to watch till the end to learn how to improve liver fat and even reverse it in mild to moderate cases. Many patients can reverse it with the changes I'll teach in this video, and I won't be selling any medicine or supplements, so you can relax. Since this isn't sponsored, I'll ask you to like this video. This helps the algorithm share it with more people, spreading this knowledge. Now let's discuss the signs and symptoms. Number 1. Body itching. Itchy skin can be a sign of liver disease. Why? The liver's job is to filter toxins. That's one of its functions. If this function decreases, toxins build up and itching may occur. If you're experiencing new itching, called pruritus in medical terms, pay attention as it may indicate liver issues. The second symptom is bloating or feeling overly full after eating. You might feel stuffed even if you haven't eaten much. This could be a sign of liver problems and should be evaluated. I'll never forget how one patient described his experience. He said, "I eat very little but feel like I ate a whole cow." It seemed like he had eaten way too much. We investigated his liver and found other symptoms, but this was the first sign. It started with that stuffed, uncomfortable feeling. So, be aware of this symptom. The third sign is fatigue, feeling tired even when you wake up. You slept well, got enough rest, but still wake up tired, struggle with daily tasks, and notice shortness of breath. You used to climb 4 flights. Now one leaves you winded, already out of breath. The liver also needs to be checked. Sign 4 is swelling, puffy legs and feet, or in advanced cases, ascites or cyti, the medical term. You've likely seen someone with a swollen belly. That's a sign of liver disease. This is a later symptom, appearing after fatigue, but it's a key liver disease indicator. This one shows up earlier, swelling in the ankles, legs, and feet. Many people tend to ignore it though. They think it's normal, assuming it's because they've been on their feet all day or due to other changes or heat. Often they already have liver issues and this is happening because of that problem. So, be aware. Swollen legs and feet also warrant an investigation of liver function. Sign number 5 is yellowing or jaundice. When liver problems start, bilirubin can increase, showing up as yellowing in the body. It begins in the eyes' whites, then can spread to the skin as it worsens. So watch for yellowing. You've probably seen someone with yellow eyes before, which can be a sign of liver disease. It's also a sign that's a bit more advanced, but it's one of the classic signs, along with lighter stools and darker urine, which is also easy to notice if you know what to look for. It's not enough to just notice darker urine without understanding its significance. So yes, it can indeed be a sign of liver problems. Sign number 6, heartburn or burning sensation. Patients with liver issues often experience pain in the pit of their stomach. After eating, it feels like food is coming back up, causing a burning sensation. This could also be related to liver problems. Sign 7, bruising easily, as the liver plays a role in blood clotting. If your liver function is impaired, you might notice unexplained bruises. These are bruises that seem to appear out of nowhere. This is also quite common. That's when I see patients with liver issues. Where did you get that bruise? Oh, I don't know. It's different from bruises you get after bumping into something. Those bruises make sense. But liver issues can cause unexplained bruises all over your skin. So pay attention, it could be a liver problem. Another sign is pain near the ribs in the upper right abdomen. Sign number 9 is hormonal changes, especially increased estrogen. What happens when estrogen rises in men? It can cause breast tissue growth. We call this gynecomastia. It also reduces testosterone. In women, estrogen increase isn't as noticeable as in men. There may be skin changes, especially on the chest, called spider angiomas. You can see spider-shaped blood vessels, mainly on the chest area. This is also indicative of liver disease. I'll show a photo to clarify what these spider angiomas look like. Now, what tests indicate fatty liver? First, Fatty liver can only be diagnosed through imaging tests. These include abdominal ultrasounds, liver scans, and other imaging like CT or MRI. Now you might think, no one gets a CT scan just to check for fatty liver. You're right. Ultrasound is indeed the preferred method. Often you'll have a CT for something else and discover fatty liver incidentally. It's an incidental finding. You weren't looking for it, but there it was. Fatty liver. This happens quite frequently. In fact, about 30% of adults may have fatty liver, so it's extremely common, okay? Now let's talk about blood tests. Which tests can detect liver changes? We've seen that diagnosis is done through imaging, but when the liver is inflamed, we may see increased liver enzymes. What are these tests? Elevated TGO or TGP. In other regions, TGO and TGP are also known as AST and LT. So they're synonymous. It's the same thing, just different names. These two tests show if the liver is damaged or inflamed. If it's due to liver fat, we call it steatohepatitis. So increased TGO and increased TGP, what about liver function? How do we know if the liver is working well? There are several tests used together. Prothrombin time, which relates to coagulation. We've seen that one of the liver's functions is to aid in our blood clotting. Prothrombin time increases, meaning a person is prone to bruising and bleeding. Another test is the platelet count. Low platelets can also indicate liver problems. Sure, there are other issues that can cause low platelets, but it's one sign that the liver might be sick, according to blood tests. Albumin is important too. Our liver plays a key role in protein production. If the liver isn't working right, protein levels can drop, making patients prone to swelling. You've seen that swelling is a symptom, partly due to reduced albumin levels, so low albumin is a sign. Another test is for bilirubin. When the liver's sick, it can't process bilirubin properly, so levels may rise. So high bilirubin is another sign. Other tests include LDH, alkaline phosphatase, gamma-GT, and hormonal profile. I mentioned testosterone can be low, especially in men, and high estrogen can also indicate liver disease. So what should you do? What's the best treatment? What foods should you avoid and what should you eat? What habits should you start or stop if you're worried about fatty liver disease? Good news, I've made a video with 18 steps to follow if you have fatty liver and want to improve your health. Click here to watch the video. I'm sure it'll be helpful. The video contains lots of scientific evidence about fatty liver. You'll benefit from watching it. Take care. See you next time. Click here to watch the video.